Christine is an enrolled nurse with 45 years experience. She has worked in general and rehab nursing and based her career in aged care in residential, home care, and dementia services. As a trainer, she has trained courses in community services, leisure and health, and individual support. In her role under CHSP, Specialized Support Services, she works as an access and support officer with culturally diverse communities to provide advisory and support services to clients and families to assist in accessing My Aged Care community home support programs, home and community care for younger people, and NDIS. Thank you, Christine, for being with us, and I will hand over to you.
There's over 100 or more access and support workers around Victoria, and we're funded by the Department of Health and Aged Care for the Community Home Support Program and by the Department of Families, Fairness and Housing for the Home and Community Care Program for the younger people. I'm based at Cultura, which is a multicultural community service in Geelong, Victoria. We're about 1.5 hours west of Melbourne in Wadwurrung country, which is part of the Kulin Nation. Others are in local councils and many other multicultural organisations that are around Victoria. My role is to provide information and support to diverse clients, their families or carers, to assist them to access and receive community home support programs, HAC PYP for the younger people, NDIS services, and other services as required. So what I find is when I go out to see a lot of these people, it is not just these services that I'm providing services for. They might have things like, if I'm in a rural area, that they need wood for fires. They might need someone to interpret letters for them. They might need check-ins. I've even arranged a funeral for a family, a vet for a dog. So my services sort of cover a big range of things when I actually go out to see the families. And I think it's very important because a lot of these people are very isolated, lonely, don't see much of people. And it's just handy that I'm available, that I can do other things besides just trying to get them their home care services and any other services they need. My referrals come from My Aged Care under the Specialised Support Services, Advisory and Support Services in Client Advocacy in the Community Home Support Manual. We are only in Victoria. It'd be nice to see these services spread right around Australia to support families and carers, to navigate through all the aged care systems and community services that are needed. I have referrals from Dementia Australia, from doctors, social workers at the hospital, family and friends, self-referrals. People will call me themselves if they know of the service. We also work where I am with settlement services. So I work with a lot of refugee communities looking after their aged care. A lot of other community organisations in the area also refer clients to me. We have walk-ins here at the office. A lot is by word of mouth. After I've seen 2 or 3 of the clients, they might spread it to other families or people in their area or their communities. And I also work with the care finders. Our care finders look after the homeless or people that have got complex needs and things like that. So a lot of times they find themselves with clients that need other services that they can't give in their role. So they will refer them to me so that I can help them in other ways that maybe they cannot because of the scope of their practice. Just to give you an idea of some of the people I work with, I've looked after this Slovenian lady, and her husband had just died in hospital, and the only people she had in her family, well, no family, she just had a friend. The social worker at the hospital had referred the friend to me. So I went round to see this lady, being just a very, very new widow. I took her some flowers just to make it a lot more friendly and just to see how she was coping. I like to sit and have a chat with them about how they're coping before I look at what they need. It gives me a chance to settle them down, look at the environment they're in. I tell them a little bit about myself and where I come from just to make it friendly. Then we rang up my aged care and I talked her through the process and helped her with that interview for her assessment. Her friend rang me when the assessment was due. I sat and attended that assessment with them to help them understand what other services they can get, because a lot of times I find that they don't really know what they need and what's out there. So I usually help them make a list of what they think they need at the time, and we go through it all so I know that they get all the services that they possibly can. So if that happens now, while we're waiting for the home care packages, of course they get some assistance with the community home support programs. And of course the referral codes that go with them are another thing that they really don't understand. So I usually sit with them, ring up those codes, get their appointments sorted out and things like that. And we write a list so they know what's happening. When the package is actually assigned, I usually provide them with a list of all the providers that are in my area to have a think about. I often suggest that they have a look at 2 or 3 of them, get them to come round and have a chat about what they're going to provide. I usually attend their sign-ups at that time to make sure, again, that the provider is going to give them the services they need. I can, with this client as well, I gave her information on where she could get her breast prosthesis repaired or get a new one. We looked at financial and grief counselling because she was by herself, and we also looked at a community visitor to come and see her. As well as that, we arranged for equipment to be returned that had belonged to her husband. And, of course, her friend, I gave her information for carer support because it's a very stressful thing if you're not part of the family and trying to look after a person that you don't know very well. So it worked out very well. She has now got all services in place, and I just keep in touch now and again to make sure that she's going all right and everything's okay. When working with culturally diverse people, of course, sometimes it's very difficult. I'm from the Australian background. I don't speak other languages. So I like to try and understand the person's background, how long they've been in Australia, where they've lived, where they've worked. And I usually ask the person or the family or the carer, what is the appropriate way to approach this person? What protocols do I need to understand? I try to visit the person where they feel comfortable in their own home. They love to show you around and take pride in what they do. And I always like to know my area well. I'm probably lucky because I've lived in Geelong most of my life, so I do know the area well, and I think it's important to know the background and where these people live and the community that they live in. I like to get to know all the cultural communities in the area. In our area, we look after 51 different cultures from very different backgrounds, different working lives, and I like to know exactly sort of where they've worked, what sort of life they've had there, what's available in the community and that type of thing in their area. It's also good to educate yourself. I attend a lot of different multicultural meetings. I study up a lot on the different cultures, so I've got a bit of an idea of what is appropriate, I suppose, when I speak to the people. We have a lot of cultural communities here, so I attend a lot of their events. I don't know how many of you have heard of the Paco Festival that we have here in Geelong, but it is a massive multicultural day with all food, parade, everything like that. And we volunteer and organise all that parade for all the multicultural people in our area. And it's a good way for everyone to mix, have a great time and get to know each other, and it works wonderful. So I invite you all down sometime to come and have a look at least once in your lifetime. With the assertive outreach, what I've done in this role is, like I said, I've lived in this area for quite a while. So I worked out different zones and areas and sort of had a look at who was in those areas, what was in those areas. So I mapped it all out, and then I went out and visited all these areas, as many as I could, in person, with a pamphlet on what I do. If I could, I'd arrange talks in these communities with their staff, like with our Senior Citizens Club or something like that. I might have afternoon tea with them. We have meetings with the ACAS and RAS assessors so that they know these services are available. So women's sheds, men's sheds, we have our community radio station where we can get the information out for services that are available. We work with the refugee nurses, the local council services, many different aged care providers, from retirement villages to residential to home care services. And I try and work as much as possible in with the hospitals around the area as well. My advice to anyone is to really get to know your area. Go for a drive around, have a look, see where you live, see what the people are doing in your area. Look at the local news. Join in everything as much as possible. It's much easier if you know your area, the types of industry where people might have worked. Anything like that is worth it to understand your different cultures and how they've worked in these areas, because a lot of them have worked in industry in our areas, in car industry and heavy maintenance and things like that. So you can understand some of their background, what their family and their schooling's been, and maybe what sort of medical backgrounds they might have from the work they've done. That's about all from me. Thank you for listening.
We are moving to our second presenter, Vandana Rathore. Vandana is an experienced human services professional who works as a program coordinator at Multicultural Aged Care. Within this capacity, she leads coordination and implementation of work plans, monitors service delivery, and ensures reporting compliance for programs like CHSP, SSD, and SSG, Care Finder, programs, and PCAC. Her responsibilities also include overseeing corporate services. With a background in public health, she has worked in projects providing technomanagerial support to organizations such as the National Health Mission and the Central Tuberculosis Division in India, as well as the Union and FIND. Thank you for being with us, Vandana, and welcome. The floor is yours.
I am program manager now with Multicultural Aged Care. I'll just probably say a quick introductory line about who we are at Multicultural Aged Care. We are a peak body for culturally and linguistically diverse aged and community care. And we also provide this leadership and advocacy to bring and keep the needs of CALD older people on the national agenda. We receive our funding from the Australian government for the PCAT program, the Commonwealth Home Support Program, and the Care Finder program, which we deliver in consortium with the Seniors Information Service here in SA. I would just like to build on what Christine has just discussed there about assertive outreach. I will not spend a lot of time on this slide, but I still feel it's important to know the stats before we dive deeper into the challenges or how we are approaching those challenges. It's important to know that 37% of the older Australians who are 65 and over were born overseas, and the number is only going to rise in the next census, as we know. And every 1 in 6 older Australians do speak a language other than English at home. Another interesting stat that has come out is that 28% of the home care users and 20% of the permanent residential service users and respite care users belong to CALD backgrounds as well. And 12% of aged care users prefer a language other than English. So that gives us a brief snapshot of how diverse the target population is that we're working with in aged care. And this is just to speak of the clients. If we look at the workforce, that's a whole different discussion out there. The workforce is equally diverse. I'm sure if you've attended and you've been keeping a pulse in aged care, you have heard of these challenges which have come through when you're working with culturally and linguistically diverse populations in aged care. And these cut across your cultural, structural, and service barriers. I wouldn't go into a lot of depth there, but if you were to focus on the attitudes to family and care responsibilities, for example, you do see that these differ in culture and in different backgrounds, and these have an impact on people's choices and the way they like to engage with service providers and the way they engage with the system as well. Language-related barriers and difficulties have been talked about in detail, and that seems to be a challenge that people have talked about in the comments as well. Throw into the mix the beliefs, behaviors, your preferences as an individual, and everything else being anchored in your cultural self, your gender roles, relationship with authority. We often see that different cultures respond differently to authority. And that is really important when you're trying to provide services and you're trying to engage with the target population here. In terms of what position do you approach the people from? What position do you approach the older people from? And how do they respond to those? Adapting to an environment outside of the home is very different from for people from a culturally and linguistically diverse background there. And ultimately navigating the system to find services that are appropriate for their culture. So before I go to the Care Finder program, I'm not sure if the people who are joining us in the webinar are aware that FECA had commissioned the Encompass, which was a multicultural aged care connector trial program, based on which the Care Finder program has come through. So the evaluation of that program was recently conducted and a report was published. And I would encourage everybody to go through that report to gain a lot more insight about the work that they did with core population specifically. The key findings that they came up with, that the cultural rapport that you build with your clients when you engage with them, especially if they're hesitant or reluctant to engage with services or the system, that's really crucial. The connectors provided end-to-end support. Now, we do know that in aged care, the clients do need a lot more support than what's expected. Usually, when you see the policy guidelines, you have to sit with the clients right from the beginning to the end until the services are set up. But the needs are far more complex when you're working with a diverse population, and you have to provide a lot more support, almost akin to hand-holding. That is what the report talks about. Co-design localized approaches where you use your community engagement work much better when you're working with diverse population. The role of bicultural connectors is really important to build that rapport and trust. And that's something I'd like to highlight in a case study that I'll take towards the end of the presentation. And community outreach. Christine talked about assertive outreach, and there is a difference between just the community outreach and assertive outreach. And I'll probably cover why assertive outreach is a key pillar for the CareFinder program. So, brief overview of the program itself. The program has been commissioned through almost 31 primary health networks, if I remember that correct, across Australia. And this was specifically put together to help older Australians who are at the risk of falling through the cracks. So it's not just the older people, but all people across the board, including the cold older people who are vulnerable to falling through the cracks, who may not be engaging as well with the system. The idea is to provide intensive face-to-face specialized assistance to navigate these aged care services and community supports. So there is CareFinder support available to clients right from the start, where they have to engage with My Aged Care, register themselves, navigate the assessment process, find a service provider, connect with them, and also follow up with them after they've started receiving the services. That's a very basic introduction, but there is no actual hard and fast eligibility criteria because it's really hard to define what's vulnerable when you're dealing with a lot of complex challenges. So a quick overview of what assertive outreach is. When we do our outreach with the community, we reach out to them and we're trying to understand what is it that we can connect with them with. But when you're looking at assertive outreach, it's meant to be a bit more proactive, a bit more persistent and ongoing. So we have been engaging as CareFinders with communities regularly, and it has been more persistent than what we would have done in a usual community outreach. So we reach out to them far more often through different channels so that we have a chance to engage with them a lot more often. And we also work with intermediaries. As Christine mentioned, there's social workers, there may be religious leaders, there are community leaders, councils, any emergency relief programs, any touch points that the vulnerable older people might be accessing. That's where we go and try to reach them. So it includes all of these intermediaries and professionals. Some of the best practices would be, I would say, start with being curious, try to know your community more. There is ABS data, there is census data online, which is great to start with. Identify those vulnerable groups within your community, try to understand their community history and background. As Christine also mentioned, try and understand on a personal level when you meet someone, for how long have they been living in Australia, what their experience has been like, what are their cultural beliefs and practices, what's important to them. There is a hesitation usually when we try to talk to someone individually, but a lot of people from diverse backgrounds are very open if we ask them those questions with a genuine curiosity to learn more about their culture. So building those networks with the intermediaries and professionals there, these community groups and leaders and champions is also going to help you with the access to the population and identifying the vulnerable people in there. Taking a person-centered and trauma-informed care approach is, again, very important for a lot of diverse populations because people from CALD backgrounds, especially older people, might have had a lot of trauma in their history of migration. So building that into your approach and your practice is extremely important. And a culturally informed practice where you engage and build a rapport which is very flexible and tailored to the individual needs of the client. And there are no wrong doors. From wherever a client is approaching you, it's great to go and engage with them. So with all these concepts there in the background, I'd just like to bring it all together with two small case studies here. The first case study is about a lady that we worked with through our CareFinder program. She came from a Romanian background, 85 years old, living by herself, no supports, no family, no friends at all. We got her referral from a local council member that she tried to approach for gardening services. And we approached her, and she was eligible for a home care package because she had recently been assessed. But she absolutely refused to engage with any service provider. She had a mistrust of any services that were provided. She said a few people visited my home, I did not trust them. I'm not sure if they took money. She just did not want to engage with any sort of service providers. Even with care finders, she had a strict approach that I only want you to approach me on text or maybe a phone call when I start trusting you enough, but I only need gardening services. And she had a financial hardship and she wanted gardening services through CHSP because she did not want to go through a home care package. It was really hard to try and convince and engage with her to begin with. So we had to continue our engagement in a very persistent manner with her to first gain her trust there. And then to explain to her that why was it really hard to try and get gardening services. Any care finder here would know how hard that is at this moment to try and get a gardening service through CHSP. So it took us almost a month and a half to engage and build that rapport. And we did not let go of the case. And we continued to engage with her. We still could not meet her in person because she was absolutely resistant to that. But we were able to get her onto a wait list for a gardening service. She's still waitlisted. It's been a couple of months, but we're quite positive once she starts accessing the service, we might be able to visit her in person and convince her to go through her comprehensive assessment for a home care package, and hopefully she uptakes the service as well. So that's one challenge we had. We did not have a language barrier, but we did have an absolute resistance to engage with the service providers or the system there. The other case study that I would like to highlight is this gentleman from Afghan background that we worked with, 82 years old, lives with his wife, no family support. We had a language barrier, and we received the referral from another care finder organization because they believed that he needed some CALD focus support. They were engaging the translating and interpreting services, but it wasn't working as well in terms of trying to communicate well with the client. And this is where I'd like to highlight the gaps within the free translating and interpreting services. They are complementary to bilingual support here. So the client was looking for some higher level of services because his comprehensive assessment, when that happened, he felt that it wasn't whatever he tried to talk to the assessor and put together as his challenges, it just did not go through. He continued to insist on bilingual support person who would speak in the same language as him. I think everything was lost in translation. The assessor did not understand, even though there was a translator and interpreting services person available. He said, I don't think he translated or interpreted the exact nuance of what I was trying to convey. So we reached out to My Aged Care to request for another assessment for the gentleman because he was dissatisfied. And on that call with My Aged Care that we spent close to 2 to 3 hours, the My Aged Care staff requested for 2 different translators to come on board, but the interpreting services were just not able to translate what the My Aged Care staff wanted to let the client know. There was a big gap. And at that point, the My Aged Care staff asked us that if the client is willing, could we just have your bilingual assist staff come in? Because it seems the client's built a rapport there and he feels it's easy for him to express and it's easier for the My Aged Care staff to explain those processes and systems to the client. So with the client's consent, we engaged our bilingual staff there. We did not use the interpreting services going forward with the client. And with each call that we made with My Aged Care, we received the client's consent, at least for the phone calls, to have the bilingual assist available. For any in-person meetings, we'd have the translating and interpreting services and the bilingual assist together for the client. So I feel it really highlights the role of the bilingual workers and how they can assist in engaging in building that rapport. And that's something that a lot of care finders are trying to incorporate into their practice. So I feel that's a great learning if you're trying to engage with the CALD background older people. It's great to not just reach out to the interpreting services, but if you've got bilingual workforce, sometimes it's just much more easier to connect with them. I'd just like to let you know that you can connect with your local care finder organizations. Please go through the My Aged Care website. But there has been a huge impact for the CALD seniors since the inception and coming through of Care Finder program. We've been close to over a year since the program has been implemented. There has been an evaluation report that you can go through as well. But definitely the assertive outreach has increased the engagement. in my experience of working with the CALD seniors, there's an improved access and understanding of the MyHK services, especially regarding the wait times, because it's really hard to communicate to older people about the wait times once your assessment and what the process would look like when you start navigating it. Culturally appropriate and tailored engagement support through bilingual staff has definitely grown, and there is stronger community and stakeholder connections.
So we talked a little bit about the case study with the person from the Afghani community. We also talked about you, Christine, talking about settlement services, that you engage with settlement services. So my question would be to both of you, what is different working with people from refugee communities? Is there a different approach that you need to take?
We have now approached one of the humanitarian settlement program providers here in South Australia, and we've started collaborating with them because they've received a huge intake of people on humanitarian visas who've just come in 65 and older, and their scope is very limited to provide them the early settlement support. But a lot of these older people now need my aged care support. And I think the challenges are much more complex when working with people from a refugee background. There is a trauma-centered approach that you have to take, a person-centered approach with trauma-informed approach that you have to take. But I think a lot of these people are with absolutely no information about my aged care, no support there. So we've worked in collaboration with humanitarian settlement programs so that there is a smooth referral and transition to our program. And we continue to work in collaboration with them because they have a trust and a rapport with these programs and the providers there.
I agree with what Vandana said, but I've found when I'm going out to visit some of these clients, I don't know whether in other states it's the same, but with the children now growing up in Australia, the culture is tending to sort of break down a bit and the elderly are getting left alone. And that's where it becomes a real problem because they do not read or write or speak English. They do have a lot of trust in the people in the settlement programs. And I find that I would usually take one of the bilingual people from the settlement program with me when I go and talk to these people, or have their children there if they haven't already run away, which some have done and deserted these people in their old age. And I find that they are a lot more comfortable with that. If they have sort of left a lot of the settlement programs, we are now starting up new programs where we can bring them back in to be with people their own age and mix and not be so isolated. So I find that's a lot easier to take them from their beginning where they first came in and built that trust. I find that a lot easier.
I just want to mention as well for the participants that there's no residency requirements for people that want to access aged care or my aged care. Just to let you know, so everybody who is in Australia, 65 plus, for seniors from multicultural backgrounds, for example, they can access my aged care. So there was a question to you, Christine, that's in the chat. Christine, do you find clients become too reliant on you, especially those who have no one else? Question from Sandra.
Yes, definitely. So most of the time my job, I am there to try and empower them to get back on their feet and be able to manage themselves so that I can walk away at some stage. Often I'll get another call a couple of months or so later when some other little crisis might hit. But usually if I can give them the right information in the right way, I take it very slowly, often in their own language as much as possible if they can read and write and speak and understand the written language. Otherwise, it's a very slow process and I just take it easy till they understand where they're going. And it's just always so good to see how proud they are when they ring you back and say, I did it and I got it all right. So my whole way is to empower them to get on their feet and be in the community. I try and help them get into groups or social events or things where they can get that courage up and mix with other people and see that it is safe out there now. It's been very hard with COVID, as everyone knows. So it's getting them back out into the community now.
We have another question that is, do you find the community aged care volunteer visitor scheme, is that accessible for everyone, even in areas, where maybe in regional or remote areas, especially if people, want to support isolated seniors from multicultural backgrounds?
Because it's been changed now, and before you had organisations where you had their own volunteer schemes, and we did at one stage. Now it's sort of gone nationwide. I haven't sort of really gone back into it, how that is going now. I would probably say when you go out into rural communities with the distance, it is possibly hard to get a volunteer to go out in that area. So it's more relying on your neighbours that might be quite a long, long way away to do check-ins and things like that, especially if they've known the people for a long time. There's a lot of really good services that do just phone talks and contacts now as volunteer, like visitors schemes that might not be face-to-face. So I think they may be more reliable in a more remote community. Around your cities and that, I think we have very good volunteer schemes going and they do work very well.
Now, I have another question that was around the localized approach. I think both talked about that it's really important to have a localized approach as part of the Care Find or Excellent Support Program. And you mentioned, Christine, you go to a lot of clubs, you engage with the op shops, with settlement services, and you mentioned as well, Vandana, it's really important to have the localized approach. So can you tell us why do you think that's so important?
In terms of localized support, approach, what we do usually at MAC is not only just reach out to the communities, but regularly engage with their leaders and also engage with culturally appropriate service providers. So we try to bring a forum together of different community leaders and different services and service providers and try to make them interact with each other as well while we are present. So that helps us build a little ecosystem there. So that's one of the approaches that we try to bring forward. And that's how people get to know each other. And there's a lot of referrals that we get right from those sort of forums in there. So that's one approach that we have. And there are other approaches where it's basically, if I were to cut out all the big words, it's just trying to access those little touch points where we know people are going to come and seek any sort of help or assistance. So we try and approach all those touch points and try to be present there as much as possible.
I think it's important to, as we move out from the main big CBD areas into suburb after suburb after suburb, and we're getting more isolated as these suburbs get bigger and bigger, I think it is really important to go and make your presence known in those suburbs because they're very multicultural areas, and the further they get out, the more isolated they are. Especially transport-wise and things like that, trying to find how to get to services. There's new services being built out there but in the suburbs, but they've still probably got to go to specialists in the main cities and things like that. So I think it's important for them to know that there are people out there that can help them, that will help them, and to try and put them into the area and know the organisations they can go to for help in those areas that are close by. So that's what I like to find out, what's available in their area close to them, so that I can say, well, you can go there to there to there, and they're not far away. You don't have to travel too far. But of course, when you're talking about remoter places, obviously that's a bit harder.
Last question, and we can sort of start wrapping things up. And that would be, we talked about these individual relationships and connections. How important do you think they are?
I think that's really the crux of what we're trying to achieve here in our practice, to build that rapport and build that trust with the client, because you have to, it's an end-to-end journey that you're taking with them when you're trying to navigate the system, right from the time that they get to know you They have to trust you. They have to have that rapport with you. So building that personal rapport is absolutely crucial. And right until the follow-up, these clients, it's not just about working with one client. We get a lot of other referrals through that word of mouth as well. If one client has had a positive experience with our program, they're likely to go out and tell 10, 20, 30 people in not just their community, as many people as they know that I had. And that's something that people from a diverse background do really well. The word of mouth, publicity, and promotion of your program. If you've given them a positive experience, it's only going to grow and come back.
Yes, I totally agree with Vandana then, for sure. Word of mouth is the big thing in our job. And I think if we can show that we're knowledgeable and concerned and we really care, and we can point them in the right direction and they get a positive result from that, I think it builds it even further. So I really try to make sure before I send them anywhere or that the service is going to be available so that they don't get stuck at all. So, yeah, very important. I run into some of my clients in the street and I get hugs and God knows what, because I remember I've done something for them. So it's always lovely.
Thank you, Christine, and thank you both for your amazing contributions, for the Q&A, and for the ones who asked questions in the chat. Thank you so much again. We hope you have a nice day.